Atrial fibrillation, often called AFib, is frequently underestimated because many people believe it is simply an irregular heartbeat that causes brief palpitations or mild discomfort. What is far less recognized is that AFib is not just a rhythm disturbance. It is one of the leading causes of severe stroke in older adults. What makes AFib dangerous is not always what a person feels. In fact, many people live with AFib for years without knowing it, until a sudden stroke occurs. When AFib develops, the upper chambers of the heart no longer contract effectively. Blood flow slows down and begins to pool, creating ideal conditions for blood clots to form. If a clot travels to the brain, it can cause a stroke within minutes. Strokes related to AFib are often more severe than other types. They can result in loss of speech, mobility, memory, and in many cases leave permanent disability that dramatically affects quality of life. Alarmingly, many of these strokes do not occur because treatment was unavailable, but because people believed common misconceptions about AFib, ideas that sound reasonable, yet are medically incorrect. One of the most common and dangerous misconceptions in people with AFib is the belief that taking daily aspirin is sufficient to prevent stroke. This idea comes from aspirin's well-known role in reducing clot formation in certain cardiovascular conditions. However, the mechanism of stroke in AFib is completely different, and aspirin is not the right solution. Aspirin works mainly by inhibiting platelet aggregation, which is important when clots form due to plaque rupture in arteries. In AFib, however, clots do not form because of platelets. They form because blood stagnates in the atria when the heart fails to contract effectively. Slow-moving blood activates the body's coagulation system, producing fibrin-rich clots that aspirin has little effect on. Clinical studies have consistently shown that aspirin does not significantly reduce AFib-related stroke risk, while still increasing bleeding risk, especially in older adults. This means patients may suffer side effects without receiving meaningful protection. For this reason, doctors recommend specific anticoagulant medications, not aspirin, for stroke prevention in AFib. Understanding the true mechanism of the disease and choosing the appropriate treatment is essential for effective and safe protection. A widely held belief is that AFib is only dangerous when noticeable symptoms are present, such as rapid heartbeat, palpitations, dizziness, or shortness of breath. Medical evidence shows the opposite. AFib can exist silently for long periods without any obvious symptoms, and this silent nature is exactly what makes it so dangerous. This condition is known as silent AFib. Studies reveal that a significant proportion of people with AFib experience no clear symptoms at all. They go about daily life normally, while inside the heart, blood flow is impaired. When the atria fail to contract properly, blood slows and pools, especially in a structure called the left atrial appendage, creating ideal conditions for clot formation. The most concerning aspect is that this process is completely silent. No pain, no warning signs, no alarms. Often the first indication of AFib is a stroke itself. Feeling healthy does not always reflect what is happening inside the body. Asymptomatic AFib carries a stroke risk comparable to symptomatic AFib. This is why regular screening is crucial, especially for people over 65 or those with underlying cardiovascular conditions. Many people with AFib believe that once their heart rate is controlled, their stroke risk is also reduced. When medications slow the heart and relieve symptoms, patients often feel reassured. However, controlling heart rate addresses how the condition feels, not how it causes stroke. In AFib, the core problem is not just heart rate, but the loss of coordinated atrial contraction. Even when the heart rate is within a safe range, the atria may still fibrillate instead of pumping effectively. Blood can continue to stagnate, allowing clots to form. Rate control and stroke prevention are two separate treatment goals. Medications that improve symptoms do not protect the brain from clot-related stroke. This is why anticoagulation is still recommended for patients with elevated stroke risk, regardless of symptom improvement. Feeling better does not mean the danger is gone. Understanding the distinct roles of each treatment helps patients protect their long-term health. Many older adults hesitate to take anticoagulants because they fear falling and bleeding. This concern is understandable, but avoiding anticoagulation solely due to fall risk often exposes patients to a far greater danger: stroke. Anticoagulants prevent clot formation in the heart. Without them, the risk of stroke remains high. AFib-related strokes are often devastating, causing paralysis, loss of speech, cognitive decline, or even death. Research shows that a person would need to fall extremely frequently, nearly daily, for the bleeding risk to outweigh the stroke prevention benefits of anticoagulation. In most cases, the protective benefit is far greater than the risk. Fall risk can often be reduced through home safety adjustments, balance training, and regular medical follow-up. Rather than stopping medication, patients should work with their doctor to find the safest and most effective strategy. After procedures like electrical cardioversion or catheter ablation, many patients believe AFib is permanently cured and that stroke risk disappears. A return to normal rhythm can create a false sense of security. These treatments improve rhythm and symptoms, but do not always eliminate AFib permanently. Structural and electrical changes in the heart, such as fibrosis, may persist and allow AFib to recur, sometimes silently. Even brief, symptom-free episodes can be enough for clots to form. Stopping anticoagulants prematurely may increase stroke risk without the patient realizing it. Treatment decisions should be based on overall stroke risk, including age and underlying conditions, not just how the heart rhythm feels. Ongoing follow-up with a physician is essential. Wearable technology has improved awareness of heart rhythm issues, but believing that a smartwatch alone can protect against stroke is a mistake. These devices monitor heart rate intermittently, not continuously. Short or nighttime AFib episodes may go undetected. Accuracy also depends on proper use and conditions. A lack of alerts does not mean AFib is absent. Many silent cases are only detected through medical testing, such as ECGs or long-term Holter monitoring. Smartwatches are helpful tools, not replacements for medical evaluation. True protection comes from combining technology with professional care. Alcohol can trigger AFib episodes, especially during holidays, leading some to believe that avoiding alcohol eliminates risk. In reality, alcohol often reveals an underlying vulnerability rather than being the sole cause. Alcohol affects electrolytes, heart rate, and the nervous system, but AFib usually reflects deeper issues such as aging heart tissue, chronic inflammation, or cardiovascular disease. Reducing alcohol may decrease episode frequency, but it does not remove stroke risk. AFib is a multifactorial condition requiring comprehensive management. Because atrial flutter often produces a more regular rhythm, it is sometimes considered less dangerous. However, stroke risk is similar. Both conditions impair atrial contraction and promote blood stagnation. Current guidelines recommend the same stroke risk assessment and anticoagulation strategy for atrial flutter as for AFib. Underestimating atrial flutter can lead to delayed or inadequate treatment. AFib is not just a rhythm problem. It is a major stroke risk, especially in older adults. Many misconceptions lead people to underestimate its danger. Absence of symptoms, rhythm control, or aspirin use does not eliminate stroke risk. When appropriately prescribed, anticoagulants remain the most effective protection. If you or a loved one lives with AFib, the most important step is not fear. It is informed action. Talk openly with your doctor about your personal stroke risk and treatment options. Never stop or change medication without medical guidance. If this information was helpful, share it, especially with people over 60 or those with heart disease. One informed conversation can prevent a life-changing event.